It's time now for Morning Rounds. Joining us are CBS News Chief Medical Correspondent Dr. John LaPook and CBS News contributor Dr. Holly Phillips. First up, a leading doctors group is out this week with new recommendations for teen contraceptives. John?
Anthony, every year in this country, 750,000 women under the age of 20 become pregnant, most of them, about 82%, unintentionally. The organization that represents children's doctors put out new recommendations to prevent unwanted pregnancies.
When Kenesha Hans was in high school and wanted birth control, her doctor offered her the pill. But it caused bad side effects, so she got an intrauterine device, or IUD.
I think that one of the great things about the IUD is that you just have to go in and have it inserted by any sort of medical professional, and then you don't have to think about it for 3 or 5 or even 10 years.
The American Academy of Pediatrics is now saying the first-line contraceptive choice for adolescents should be IUDs and other long-acting forms of birth control, such as hormonal implants or injections. Dr. Rebecca O'Brien is a member of the recommending committee.
The research has shown that these are just as safe in adolescents and young adults as they are in older women, that they really do not have any long-term risks associated with them.
Condoms and the pill are currently the most common forms of contraception, but mistakes are often made. For example, the pill is 99.7% effective if used perfectly, but only 91% effective with typical use. Condoms are only 80%. An IUD is more than 99% effective with typical use. Gynecologist Dr. Jillian Dean is a physician at Planned Parenthood.
Most adolescents now take the pill. What's the matter with that?
It requires a lot from the user. And adolescents, like the rest of us, have a lot on their plates, and it's hard to remember to take a pill every day. It's hard to get to the pharmacy once a month to get your prescription.
John, how do IUDs work and how do they differ from birth control pills?
Well, IUDs work by basically setting up a hostile environment for the sperm inside the uterus. So they're kind of like spermicides. The pill works by preventing ovulation. So the egg doesn't actually get released from the ovary, and also does set up a hostile environment for sperm too. And some IUDs have hormones, and then that also can make it difficult for the sperm to enter the uterus through the cervix.
But Holly, in the 70s, IUDs sort of got a bad rap. A lot of people said they caused infections or increased infections. What's changed?
You know, that's right, Vanita. Back in the 70s, there was a form of IUD called the Dalcon Shield, which was ultimately recalled after it was linked with some uterine infections. But since then, we've had decades of research showing that they actually are incredibly safe, and the likelihood of getting an infection is really, really low. So these are quite ideal for teens in that they can stay in place for, well, IUDs can stay in place for 3, 5, or even 10 years. And some of the implantable birth control that goes, say, under the arm, the rods, they can stay in for at least 3 years as well. This is one of those methods where it's virtually 100% effective, and teens can't forget to take it.
John, when you think of teenagers and birth control, you usually think of condoms. So is the Academy basically saying forget that?
Definitely, they are not saying forget that, and they are specifically encouraging the use of condoms for those kids who are sexually active. Now, the IUD, the birth control pill, does nothing in terms of preventing sexually transmitted illnesses. So it's very important to use a condom in addition to those.
The enterovirus outbreak is taking a dangerous new turn. It has spread from 12 to more than 40 states in just 3 weeks. Now doctors are worried the virus is linked to the deaths of 4 patients, including a 10-year-old girl in Rhode Island. So how does this spread?
Unfortunately, it spreads very easily, just like the common cold. You know, actually, the enterovirus is a cause of the common cold, and there are many different varieties of the virus. This one, enterovirus D68, has been relatively rare until now. So respiratory secretions, we think of coughing, sneezing. You touch something that a sick person has touched and then touch your nose or your mouth, that's how it's spread.
John, what's the link between enterovirus and paralysis?
Well, now we're seeing some cases of kids who have weakness in the arms and legs after having had an infection with D68. And it's not clear whether this has cause and effect. So there are 10 kids who were in Denver. And I just spoke to somebody from the CDC who said that even though the virus was present in the respiratory secretions, it wasn't present in the spinal fluid. So is this a true unrelated? Is it that the virus is somehow attacking the nervous system, or perhaps it's not the virus directly attacking the nervous system, but your immune response to the virus gets confused, sets up antibody reactions that attack your own nervous system by mistake?
All right. There's a new link between living near a major roadway and the risk of high blood pressure. The Journal of the American Heart Association reports women who live within 100 meters of a highway or major road, that's about 330 feet, increase their hypertension risk by 22%. That's compared to women who live 1,000 meters away, 10 times as far.
Well, Americans have a new way of checking up on their doctors. A federal database lists financial ties between medical providers and drug companies. Those transactions total about $24 billion a year. The Physicians Payments Sunshine Act is part of the Affordable Care Act. Holly, it certainly feels like in every realm, people want more transparency, and that's what this will offer.
Sure, you know, and in many ways, this is a good thing. Basically, this is so patients have access to understanding the relationships their doctors might have with drug companies, equipment manufacturers, medical device manufacturers, and these things actually have been monitored in the past. Teaching hospitals are very closely monitor whether or not their doctors have relationships with these drug companies, as well as academic medical institutions. But this is the next step where patients will have easy access to that information as well.
John, how big a problem is medical conflict of interest? I mean, how much do we need to be concerned when a doctor prescribes, you know, a medication or some kind of medical device?
I think it certainly is a problem in terms of the scope. I think we're going to find out more and more as it becomes transparent. I should say that I went online last night and registered, and I didn't find it the easiest thing to do. I mean, surprise, surprise. Mm-hmm. It's a government website that's trying to reach out to doctors, and it took me a long time to download the list of doctors. I wasn't on it. I was happy to see. But in just trying to just do a search of one doctor at a time, very clunky. So they need to do some more work on that website.
Is it money? Is that why some of these doctors have ties to Big Pharma?
Well, you know, it actually is a natural relationship. Doctors are in a really unique position to advocate for patients, you know, with the drug companies, so that drug companies develop and you know, create new drugs that will serve patient needs. But also, the drug companies can't sell medications unless the doctors distribute it. So, yeah, I think more transparency is good. It'll make sure that everybody's focusing on the patients rather than sort of the financial bottom line.
Finally this week, you like a big breakfast? Well, here's an 8,000-calorie one. It comes from a British cafe chef who says no one has finished it yet. You need to sign a disclaimer to order the Hibernator. It includes 8 slices of bacon, 8 sausages, 4 pieces of fried bread, black pudding, beans, tomatoes, mushrooms, and French fries. Oh, and there's also a milkshake.
Here you go, Anthony. You want to sign the disclaimer and go ahead and get your set.
I love that there's informed consent for a meal. And it makes sense because I did the calculation. There's 3,500 calories in a pound of fat. You're eating the equivalent of more than 2 pounds of fat. That's right there in that belly.
They say it weighs 7 pounds, so just weighs a little more than you actually will gain, right?
Oh, my goodness.
Dr. John LaPook, Dr. Holly Phillips, thank you both.